gantse le mafatshe ka dikgwetlo tsa one le tse ba di ipeileng pele.
That's where it started to say, you know, we can do something about cancer just like we've all done something about HIV/AIDS. I think the idea of go together is that other countries in Southern Africa, especially the ones with the same size population, dealing with some of the same issues in their health system, Namibia, Lesotho, Eswatini, since the issues are the same, why not learn together, go together, and you'll go farther.
We are also looking at strengthening governance, looking at all the frameworks that we need to be looking at and making sure that NCD care is really well governed in our country, including cancer care.
The main question then is, if you've talked to somebody and they know I have a lump, then what happens to them after that? Is there proper linkage? So it's part of what we're doing with the Go Together. It's part of what we're doing with the navigation, right? So we are saying, if someone has talked to you, somebody should be ready to diagnose you. And someone should also be ready to give you the treatment that you need.
Ba ba neng ba tseneletse dipuisano tse ba ne ba nna le sebaka sa go buisana ka tlhokomelo ya kankere mo nakong ya gompieno mo dikgaolong tsa bone go akaretsa dikgwetlo di amana le bodiredi jwa botsogo go fiwa kalafi ga mmogo le thibelo ya bolwetse jo.
Botswana has done pretty well with regards to palliative care. Again, Namibia, we lack a policy. So we would want to leverage on what you've done already to see how we can improve palliative care in our country. As a hospital,
80% of our population lives in the rural areas, which are scattered away from each other. And for our patients to get access to care, to travel to the nearest health post, that becomes a great challenge.
From Eswatini, our story started with data. That is the evidence. When you look at our data, it showed that we are seeing an increase of our people being diagnosed with cancer.